Hello, everyone. Welcome to Beyond Therapy with Ritu. I'm your host, Ritu Nilofer. Today, we're going to talk about a common topic, something that we experience every day and something that we're hearing about every now and then. We're talking about anxiety. Today, in this episode, I'm going to help you understand what anxiety is, what it isn't, how it works, and how to deal with it. Let us start from understanding what anxiety is. What is anxiety? It is a normal human emotion that becomes problematic when it becomes excessive or persistent. As humans, we all are trained to survive. Our brains are constantly analyzing for danger, and anxiety plays a very important role in keeping us safe. And which is why I explained to everyone saying that anxiety is actually a friend that's misunderstood because it is that friend that is trying to protect you, but sometimes goes a little overboard. Now, what do I mean by that? Um, Imagine that you're living in a flat and there are smoke detectors. Whenever there is smoke, that smoke could be any smoke. अगरबत्ती का धुआं हो सकता है, चूल्हे पे कुछ जलिया वाला धुआं हो सकता है. It could be any smoke. When that goes and touches your sensor, it starts producing danger alarm, and it and of course asks you to evacuate and brings in the fire department, which means that it's telling that hey, there is danger right now, and I want you to be safe. So just get out of here. That's the thing that it says. Similarly, your brain has the exact same system. Imagine that a part of your brain now is sensing and constantly analyzing things around, and it detects some sort of danger and tells your brain that, hey, I need to get out. That's when your fight or flight response kicks in, and your brain asks you to either get out of that situation or fight it. So, let me explain that with an example. Imagine that you're crossing the road. Now, we are not going to cross the road singing or humming something. We're going to be alert. If you ever notice how your body is when you are out, it is constricted, your breath is a little tight, and you're aware of your surroundings because there is a chance of getting hit on the road, which means the chances of being in potential threat or danger is high, which is why our brain is active and it tries to keep us safe. So it tells us, sends us these signals in our body, prepares our thoughts saying, hey, be careful, something might hit you. So these are the two things that the brain does, and many other processes that it activates that I do not need to get into. But that's how it prepares you for any potential danger. Now, imagine that you've crossed the road and you've come to the footpath. Now you're in the zone of safety. So this entire system turns off. Your anxiety, which is your basic anxiety, just turns off. And now your heart rate is fine. Your body is a little more relaxed. And, you're able to just go on. Thoughts are also less this time about danger. That's how our anxiety works. It helps us function. It helps us be safe. If you've watched this movie Inside Out 2, where they introduce this new character called Anxiety, that character is very well explained and depicted. And as a therapist, I thought it was super intriguing how little details were captured of anxiety in that movie. Go and watch it if you haven't. But that is definitely an apt explanation of anxiety. Moving on to what happens if my system is not turning off even when I come onto the footpath. Now, that is where we call it a problem because now the anxiety is not needed anymore. I am safe, but still my system is kind of perceiving danger that is probably not there. That's when we seek help. That's when we know that anxiety is now causing distress or dysfunction into a place that it need not be. Now that we understand what anxiety is a little bit, let's talk about how it affects our body. So it affects the interplay between your mind and body is complex when it comes to anxiety. It gives you both physiological symptoms, which is symptoms of your body, like sweating, your heart rate increasing, breath rate increasing, etc., giddiness. And it also gives you mental symptoms like overthinking, ruminating, having a lot of anxious thought patterns. So, why does these happen? It happens because your body is now preparing, your brain is preparing your body to get into either of these responses, either flying away from it or fighting it. So imagine that my smoke detector told me, मैंने अगरबत्ती light किया and the अगरबत्ती का धुआं went to the smoke and it started detecting danger. Well, in fact, agarbatti smoke is not life threatening. But if my brain perceives it as danger, then it's going to activate these symptoms to help me fight it. And in case it increases and stays for a long time, that's when we call it problematic anxiety. That's when we treat it, because now it's not in my control. Now that we know about anxiety and how it affects your mind and body, what is it that we can do? Remember, I gave you this example saying how, smoke detectors work with agarbatti ka dhua, if it detects danger. That is not life threatening, right? It's just a smoke that is there. It's going to do nothing to your body, nothing to anyone in your life. So, that understanding is what sometimes goes out of context for us. And in therapy, which is one of the most common ones that we use, is CBT, cognitive behavior therapy, we try to bring that perception back. We try to rewire the brain in understanding that, hey, you know what? I don't think this is potential danger because that is just the smoke from agarbatti. So we try putting things in perspective. Now, that must have sounded a little simple, rewiring your brain and reframing your thoughts. But imagine that you're doing it when your alarm is going off, beep, 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 and you're trying to put in this thought of, hey, that's just agarbatti smoke. Imagine how difficult that must be. And it is sometimes that difficult to work with anyone who has anxiety within. So if you do feel anxious and you feel like you're not able to change your thought, then it's all right. It is meant to be slightly challenging, because how can you make sense when the alarm's going off? So the first thing that we can do is get that alarm to turn off, which is probably calm it down a little bit. And that's where we use relaxation as a technique. One of the things that I can tell you that you could do whenever you feel anxiety or you feel like someone else, one of the most common questions that people ask me is, what can I do if someone else is having anxiety? And although there are different types of anxiety, like panic disorder, generalized anxiety, which is some things that we'll talk about in the future, a general, a simple thing you can do when someone's anxious is try to ground them or help them ground themselves. What I mean by grounding is practicing some sort of relaxation. Few of them are breathing exercises. A very famous one is 4-7-8, where you inhale for 4 seconds, hold your breath for 7 seconds, and exhale through your mouth for 8 seconds. You can do this for as long as you need until you feel calm. What this does is, you remember, let's go back to the primary thing where I told you that a part of your brain goes, the alarm goes off. So this kind of relaxation activity or any grounding exercise in general calms that area and just lets you know that, hey, I think we got this and maybe it's not that bad. And we need that it's not that bad to move forward from anxiety. So that was our episode about anxiety. It is a very, very brief introduction of anxiety. We're going to dive deeper into this very vast topic in the future episodes. Let me know what you understand and drop in any questions that you have. Thank you so much for staying tuned. Until the next episode, let's do this together, navigate our mind one step at a time. Our goal is to create a safe and supportive space for exploring mental health topics and fostering personal growth. Please remember that the information shared here is for informational purposes only and should not be considered a substitute for professional advice or treatment. If you're experiencing mental health concerns, please seek the guidance of a qualified mental health professional. We are committed to providing accurate and helpful information. However, it is important to approach this content with an open and mindful attitude. What works for one person may not work for another, and it's essential to tailor self-care strategies to your individual needs. We value the privacy and well-being of our listeners and the guests on the podcast. Any personal information shared on this podcast will be treated with confidentiality. We encourage open and respectful dialogue, and we aim to create a supportive and non-judgmental environment for all. Thank you for joining us on this journey of self-discovery and well-being. Let's approach each episode with curiosity, compassion, and a mindful intention to learn and grow.